We at Campbell Clinic cover most of the professional and collegiate athletes in this area, including the Grizzlies and Rhodes and University of Memphis, as well as many of the high schools around the area. So we're very familiar with the latest techniques. We take care of high-level athletes, and whether you're a professional athlete or you play Little League baseball, that's incredibly important to you, and you want to be involved and continue to be able to perform at a high level, and that's why we're here. Some of the most common injuries we see and complaints we have is heel pain, heel cord pain, which is called Achilles tendonitis, or sometimes even a rupture, those kind of injuries in athletes that are associated with sports. Instability, that's often seen in soccer players and gymnasts. We oftentimes see big toe pain or midfoot pain in ballet dancers, or any dancer. Any of the dancers are often on their toes a lot. A lot of the track athletes will have the midfoot pain or great toe pain because they're up on their toes a lot. So we see that a lot. Most of these are repetitive stress injuries that, if we can get the right cushioning, the right conditioning, if we can have them start to work on strengthening and stretching in very particular ways, those can be overcome and go away. When folks participate in high-level sports, which very many people in this area do, oftentimes it's repetitive injuries, but they can flare at times, and we can work to get it calmed down, missing a minimal number of sports days and games. I do think sports injuries are one of the areas that you ought to seek treatment early for, because if you roll your ankle several times before you see me or one of my colleagues, then the options might become more limited, and it could be more of a chronic condition that's more difficult to get back to baseline and avoid having recurrent injuries over time. And so if I can see patients early with that, we can get them appropriate strengthening, appropriate bracing, so that won't become a repetitive problem and recurrent problem. But it often does. Now, we certainly see the athlete that's had recurrent injuries over and over. We often need to look into that more closely. Sometimes these patients might have what's called a collagen disorder. They might be just more loose than the average person, and we can address that, and there are ways to help that, but we need to know that early. And so looking into the whole patient and seeing if they have loose joints in other areas allow us to address those conditions and get them back to sports. There are a few reasons patients avoid seeing us. Number one, most athletes are tough, and they just don't want to admit they're hurt, and so it's a rub some dirt on it mentality. And then athletes also don't want to miss games, and they want to play through it, and they worry that if they see me, they'll be out. Part of my job is to get athletes back on the field and back on the court as quickly as possible, as safely as possible. And so that's always in the back of my mind. And so that's my goal. I'm not keeping patients out of, and athletes out of sports any longer than I absolutely have to. And a lot of times, if I can see them earlier, they will miss fewer games than if I see them later. If you experience an injury and have significant swelling, if you have difficulty putting weight on that area, if you're just not able to participate in whichever sport you are in, then you should see me quickly, because If I see that late, a lot of times that results in excess games missed than if I had seen it early on and were able to treat that early.